So these are the supplies we need for a barium enema. We have towels, because things do get messy here. We have our barium bag and our barium that we will be using. We also have gloves. It's always important to have gloves. And then our inflator, balloon inflator, so when we push it, the balloon inflates there. And then we have our jelly, lubricating jelly. And then our hemostats to clamp that balloon up. And I believe that's all we need. So I have my bag over here that I'm going to mix with there. I'm going to mix with the water. We add about 500 milliliters of water first to start with some lukewarm water. Close it and then shake it vigorously for about 20 to 30 seconds. And then we wait about 5 minutes, and then we add more water depending how much density. There's a chart behind the bag and it tells you what density you want and how much more to add. So you fill it up with more water, close it up again, and then shake it again. And after we shake it, we make sure this is closed off so the barium won't come down. We're going to pop that balloon that's in there. It's a little red one. And we're going to hang it up here for about 24 inches away from the anus, no more than that. Barium should be coming down. Whoa, there it goes. So after we have the barium up, instead of using this one, since this one's just single contrast, we're going to pretend this one has barium. This one would be the one hanging. We're going to go ahead and put on some gloves. And then we're going to put some lubricating jelly on the tip. Just a little bit. And then we're going to have the patient in the Sims position, prone on their right knee. And then we're going to go ahead and insert it about 1 to 1.5 inches anteriorly. And then a little bit, push it forward up for about no more than 4 inches. And then we're going to go ahead and inflate the balloon. And then close it off. And clamp it for extra security. And then we call the doctor and just wait for the doctor to come in and we'll start the barium. Hi Lisa, my name is Nora. I'll be taking your overhead projection.
Hi.
Can you tell me your date of birth?
April 20th, 1990.
Alright, so I'm going to go ahead and start off taking your picture so you can go ahead and lay down prone, facing down. So I'll be using a 14 by 17 with a 30-degree angle cotton. And I will be centering at the as-is midline. I line up my lucky and I use a technique at about 90 to 100 and a mass of about 30 to 40, and this one's to show the rectosigmoid. So you can go ahead and just take a deep breath in, blow it all out, and this is when I take it at suspended respiration. Next I'm going to do a PA. This one I'm going to go ahead and center at the iliac crest midline. Line up my book 14 by 17. And this one shows the entire colon. And it's also taken at suspended respiration with a KVP of 90 to 100 and mass of 30 to 40. Now I'm going to go ahead and do the obliques. I'm going to have you rotate on your right side. Just a tiny bit, bend your knee, just like that. And it'll be at about 35 to 45 degrees rotation on her body. And I'm going to go ahead and center also at the iliac crest 1 to 2 inches lateral to the midline. And I'm going to make sure my bucky's lined up. And again, it's a KVP of 90 to 100 with a mass of 30 to 40. Now I'm going to do the other side, the LAL. Stand up a little bit, 35 to 40, just like that. Scoot forward a little bit. Good, and again, same centering at the level of the iliac crest. It'll be 1 to 2 inches lateral to the body, to your midline. And same KVP 90 at about 30 to 40 mass. And all these were in 14 by 17. And now we're going to go ahead and I'm going to have you roll up straight on your left side. This one I will be doing her rectum. And I use a 10 by 12 on this one. I'm going to have you scoot forward a little bit. And I'm going to center 2 inches posterior to the as is. I'm going to find the as is and then 2 inches back. And that's where I will center. And take the image at about 90 to 100 kV and about 45 to 50 mass. And I'm going to go ahead and do her DQs. I'm going to start off with the one she's in right now, in left. And this is the left PA. And I'm going to use a grid. It's a 10 to 1 or 12 to 1 grid. And it's a 14 by. And I'm going to put this in front of her. So I went ahead and set that up. And I'm going to put a sponge under her, between her back and her hips. We can lift up a little bit. Lay back down. Sorry. And then again, it's also at the iliac crest. The grid is also at the level of that. There we go. And I also shoot this at about the same 90 kVp at around 30 to 40 mass. You can go ahead and turn on your right side now, Lisa. I'm going to have you scoot back a little bit, just strain out a little bit. Right there, just put your arms up. There you go. And again, center at the midline, at the level of the iliac crest. And shoot about the same KVP, which is at 90 to 100. And then at the mass of 30 to 40. And after this one, I'm going to have her go to the bathroom, and then after she's done going to the bathroom, I'm going to have her come back in for a post-evac. So now I'm going to position her for her PA, for her post-evac, and it's also 14 by 17. And I'm going to use about 90 to 100, and then, well, not so high, but still about 90 kVp at a mass of about 30. And I line at the level of the iliac crest. And then I go ahead and line up my buggy and take the images at suspended respiration. And that's it for the overheads of the barium enema. This image is a PA projection of the large intestine. As you can see, we can view the entire colon, including the splenic flexure and the rectum. And this is everything we want to see on this first image. And the only thing missing here is our marker. This one is the PA axial of the sigmoid. It has a 30 to 40 degree caudate angle. And what we want to see here is the rectosigmoid area of the colon, which we do. This one here is the RAO. The patient is rotated 35 to 45 degrees. And here we can see the right flexure, ascending colon, and the sigmoid portion of the colon. And again, the only thing missing here is our marker. This one here is the LAO. The patient again is rotated 35 to 45 degrees. And we're missing our marker again. But this one is to see the left colic flexure and the descending colon, which we can. This next one is the left lateral of the rectum. And this one is so we can view the rectum and the distal portion of the colon, which we could see. And this one does have our marker. And also we would like to see the femurs, the hip joints, the femur heads superimposed of each other. This one here is the right lateral DQ, AP. And with this one we view the side up, which is the ascending colon, the medial side of it, and the lateral side of the descending colon. And we can see them here with the outline of the barium. And we label, depending on what site you are, you label the image. This one's labeling it the side up, which is left, is the side up. This one here is the left lateral DQ, PA. And this one is so we can view the side up also. And we're looking at the medial descending colon, the medial side of it, and the lateral side of the ascending colon. And again, we went ahead and labeled the side up, which is right. This image here is the post-evac PA. We just want to see how much of the barium got out. So we like to include the entire colon, or try to include as much of the colon as we can. And the only thing wrong with this is that it did not have a marker, but you can see how the intestine is not blown up like with air, as you can see in the other ones. So we can say that this was a good image.